Fantastic. Dee, take it away.
Okay, today we're going to talk about in-home safety planning. And so for those of you who aren't quite sure what this refers to, it's the plans that a child welfare agency would engage in to keep kids safe in the home without them being placed in foster care. So a lot to say about this subject, but maybe just a couple of introductory remarks here. So you might think the current child welfare system's between 50 and 60 years old in most states. And so you would think that child welfare agencies around the country, indeed around the world, would have been for decades trying to figure out how to better protect kids from child maltreatment, particularly its serious versions, without putting them in foster care. And yet, somehow, amazingly, that's not the case. So one of the things that makes in-home safety planning so very, very difficult to improve, to decide what practices are more effective, less effective, and so forth, is that there just isn't much research on the subject. And particularly, there isn't much research on the subject in the last 2 decades. So again, amazingly as it sounds, there was actually more interest in this subject in the 1970s and 80s and maybe in the early 90s. There was some research on the subject at that point, which I will say something about here in a minute. But since that point in time, really not very much. And of course, that is just a tremendous handicap when you start talking about trying to safely reduce the use of foster care. As of course, this state is now engaged in a really risky experiment with that in law. And so again, you would think that this agency, just child welfare agency, compared to all others, would just have a tremendous interest in this subject. And in terms of investments, both in research, but also in the various kinds of services that one might think would be helpful to maintain kids safe in their own homes there, right? So what the lack of research actually means then is that the child welfare field is almost completely dependent on practice wisdom. And I don't want to, tear down the importance of practice wisdom. In every profession, there are practices that people view as effective and safe, and the kind of things that best practices is the lingo in child welfare. Every field has a version of that, and that would always be true based on people's experience. And that's true in safety planning as well. And we're going to talk about what that practice wisdom here is in a few minutes. But you always want practice wisdom, if at all possible, to be complemented, supported, and strengthened by research. And here it just has not been. And I guess that is a baffling kind of absence. So you end up in a situation here where, truthfully, no one is quite sure completely what works, what doesn't work, good practices, best practices, because in a manner of speaking, it's all opinion. And of course, that doesn't mean that all opinions are equal. Some people's opinions are definitely better informed and based on lots of experience and reflection. And those opinions should not be discounted. But there's no way to make up for the lack of research. I guess I just want to say that. And so this is something that, in an editorial way, I guess want to say just needs to change immediately. I mean, foster care in this country is coming down dramatically in terms of numbers of kids in care. And that's not just true in Washington. I mean, it is true here very dramatically, but it's also true in many other places around the country. And yet, again, mysteriously, there is this lack of, and not just research, but seemingly interest in the whole subject of safety planning. And so that's where we kind of begin here. So in past years, so let me just do a little bit of a go back a few decades here, before people even used the language of safety planning, before they even did that. And so I had mentioned that in the 70s and 80s, there was a lot of research about the effectiveness of service interventions and child maltreatment. And a lot of that research was done by an entity called Berkeley Planning Associates, which was a university-based kind of consortium of researchers, and the federal government funded 90-something studies with over 4,000 families over a period of 10 years. And a lot of that research was ultimately summarized in articles by, at one point, very well-known researchers, Ann Cohn and Deborah Dayro. And this was way back when. And these articles were published in the 1980s. And the main findings from those articles at that time was that during the course of service interventions, when kids were left with their families in cases where there had already been findings of abuse or neglect and where there were serious concerns about serious maltreatment, about 30% of the children in these cases were seriously re-abused or neglected. I don't mean just re-abused or neglected. I mean seriously re-abused or neglected during the course of the service intervention. So I want to say that again. In the course of the service intervention, almost 1/3 of kids in these Berkeley Planning Associates studies were re-abused and neglected while services and treatment was going on. So, of course, at the time, that wasn't even discussed in the context of substance abuse, mental illness, domestic violence. It was just sort of a standalone kind of finding. But of course, given what's happened in the last 30, 40 years, of course, we know that chemical dependency, mental health conditions, and a lot of times domestic violence as well, are chronically relapsing conditions. That is, even when people are in treatment, even when they're motivated to recover, they're likely to have times when they go back to using, or in the case of mental illness, even when they're in a recovery from mental illness, they're likely to have relapses of various sorts. Depression is about as chronically relapsing a condition as substance abuse is. And of course, that is true of many of the families that are engaged in domestic violence as well, that is a periodic kind of a phenomena there, right? So children are living in these families. And so then the question, of course, becomes, well, what kind of practices, what kind of things can be done to protect kids who are still living in these situations, given the fact that these are ongoing chronic conditions that are going to affect their childhood until they're grown. So that's sort of the context of it. So there was a time in child welfare way back when people sort of like me, I was a caseworker in the 1970s and 80s. There was a time when many of us engaged in sort of informal safety planning with families, at least I guess I would call it that now, without necessarily even writing it down in a plan. So there might not even be any written document to support it, nothing that would show that the parents ever agreed to do X, Y, or Z. And so one of the first things that happened a long time ago, and this was way back when, was that states reasonably and started to require that safety plans be written down and that parents actually sign them. And that seems mind-boggling now, maybe baffling why that wouldn't everyone wouldn't have intuitively understood that from the first, but that really suggests how far we've kind of come there. So one of the things that happened then in the sort of the early 2000s is that there were some child welfare experts in this country, people for whom I have a high regard, who published articles on in-home safety planning, the main theme of which is that too many plans are solely dependent on parents' promises. So this has been a common theme and practice wisdom for really a long time. And so the idea was that caseworkers were interacting with parents who had drug abuse and neglect problems. And maybe one of the components of a safety plan might be, I will not use drugs while my kids are with me, or something like that. I mean, there would be promises that it would be very difficult for many of the parents to actually keep. And of course, in truth, a lot of times those plans had little or no effect on parental behavior. And of course, it's inherently absurd to say something like, I will not become mentally ill again while I have my children, so there are just some kind of promises here that were viewed as very questionable, to say the least. And many safety plans seem to totally depend on parents' promises. So what happened? This was, going back almost 20 years now. So one of the first pieces of practice wisdom there was that safety plans should not depend on parents' promises to do X, Y, or Z or whatever. Some people in child welfare, including the experts that formulated these principles to start off with, and even some states, actually wrote policies then to the effect that safety plans should not contain parents' promises. Well, this is a very much of a really questionable idea here. It's one thing to say that a safety plan shouldn't totally depend on the promise of a parent to do X, Y, or Z. It's another thing to say that safety plans should not involve promises at all, commitments of parents to do X, Y, or Z. What could a safety plan mean in many situations if parents weren't making commitments to do various kinds of things? And I don't think there's any meaningful distinction between a commitment and a promise in this particular context here. So some of the practice wisdom, this just shows you the danger of depending on a few people, no matter how well informed, how smart, how thoughtful, to formulate practice wisdom for the whole entire field without the support of research here. So when I worked for Casey Family Programs from 2010 to 2016, and during that time, I visited states. We even did a study of in-home safety planning in 6 states, including some states in the South, and had people found out that some states actually had policies that said you will not include parents' promises in safety plans. So you would wonder, well, what would the safety plans be? What would they consist of then, if parents weren't committing to do X, Y, or Z? And for example, in the area of physical discipline, you would expect that a safety plan might involve a commitment that a parent wouldn't do certain kind of things, like use a belt on kids or slap kids or pull their hair or something. They wouldn't engage in physically abusive behaviors. There are actually states that were then saying, well, we don't want you eliciting promises or commitments of parents of that type. Well, then what were they actually doing? So there got to be the thought, this again is in the practice wisdom, that safety plans really depended almost completely on safety monitors. That is, on someone that the family trusted, usually not a caseworker, usually not, maybe not even a professional person. It might be a relative, it might be someone like that, but someone who the parent trusted and who had access to the family home on a regular kind of basis, at least once or twice a week, and would be able to therefore check on the status of the children and on their physical safety and be alert to indicators. So people, particularly who have drug and alcohol problems, and as they move into a relapse phase, they tend to show indicators of that in their behavior. And so the idea was that the safety monitor could then, notice those signs of impending relapse and be in touch with caseworkers about it and so forth. Well, not surprisingly, so this idea of the importance of safety monitors is still very much of a feature of the practice wisdom in the child welfare field. And it's something that I really do agree with. I mean, I agree that there need to be safety monitors in these cases. It's just that I don't have the same confidence in them, perhaps, as some other people do, or they appear to have, right? So sometimes these are family friends. Sometimes it might be a pastor, a minister. It might be a substance abuse therapist. It might be someone that the family has come to trust that is going to be in touch with the family on a regular basis. So here is one of the kind of the pieces of practice wisdom that I have developed over the years through my own very hard-won experience here, is that for a safety plan to work at all, someone has to be monitoring that plan very assiduously, very conscientiously, and at the very least on a weekly basis, once or twice a week at the very least. There have been periods in this state when the policy around safety planning has said something like, Once there is a written safety plan, then a caseworker has to visit the family on a once-a-month basis. Any safety plan like that is a totally worthless thing. So here's the thing that I have learned from my experience over the years. Safety plans, even when people commit to them, even when they are motivated to carry them out, have a very short lifespan. That is, and that lifespan is not more than a week or two. That you can count on people doing what they said that they are going to do. And so this is one of the reasons why someone needs to be checking up, not just on the status of the children and on their safety and how they're doing and on family interactions and so forth. Someone actually needs to be checking up on the other elements of the plan and doing that every week or two. So remember, many of these plans are substitutes for foster care. They are intended to protect kids 24/7 and very little kids, very vulnerable little kids. Well, how would one do that with a once-a-month visit? I mean, that's just, the whole idea is ridiculous. And that is why I say that the whole area, the whole thinking about safety planning has been inadequate. It's been weak. It's been poorly researched. It hasn't been followed up on. And even when agencies have had these rules, whatever the rules are about written plans or around safety monitors or around checking up on the family every week or two, whatever that policy is, those policies themselves have not been followed. So if the policies themselves are highly questionable and debatable, because again, to say this again, they're not based on research. But even when they're carried out as proposed in a policy manual or a procedural manual, something like that, they're still not being followed in many states, including in this state. And so if you want a real eye-opening kind of experience, the last 2 or 3 months, I wrote sounding board commentaries on child maltreatment fatalities. And to do that, I went back and read 40 child death reviews of kids who had died in this state from child maltreatment in 2020 and 2021 and 2, over a 3-year period of time. Many of those kids had safety plans. Not all of them did, but many of them actually did. And as those fatality reviews made clear, those plans, just whatever you thought about the content of the plan, whatever that was, it just wasn't happening. I mean, the plan, it was just something on paper. It was just phony baloney. Caseworkers were not visiting regularly. If family members said that they would do X, Y, and Z, they weren't doing it. One of the things that I learned from reading those fatality reviews is you just cannot count on the promises of relatives to do X, Y, and Z, not just the promises of parents. You cannot count on relatives to do what they say they're going to do in safety plans. Someone has to be checking on that every week or two for it to have any chance of success at all. So I found that many of the time, those plans just sort of vanish. They gradually, after a week or two or somewhat longer, no one was actually following them at all. And yet no one went back and attended to that in terms of another meeting or another case planning document, or it was just all by the by. So what I found from reading those child fatality reviews is, by and large, those child safety plans were fictions. They were legal fictions that were put in case records to justify the idea that kids were safe in this particular home, but the plans were not being followed. And that was, by the way, the rule. That wasn't the exception. That wasn't some sort of bad case where a child died. That was the rule in these cases. Over and over and over again, safety plans just simply were not followed. So before I go any further here, talking about, well, what would we want to do in safety planning? Let me just stop and see if you have comments or questions.
Well, this is Carolyn. It occurs to me that we also use safety plans to make it okay to dismiss a case. And so if you had a relative who did find a problem, who are they going to call? CPS? I mean, it would have to be a really extreme situation for anybody to do anything. There's nobody's going to reconvene the group. And in fact, most of the safety plans that I've been involved with did not even involve a meeting with the people that were supposed to be primarily responsible for keeping an eye on the situation. So
So that's just a sign right there that it's phony baloney. A lot of it is just, this is what I'm trying to say. It's just a virtual, it's a fiction of documentation. It's not something that people are actually committed to and doing. So there are some signs of safety plans where people really kind of mean it. And you sort of identified one of the pieces of that is that you bring people together engaged in a safety plan for a meeting. And, face to face, you sit down and decide, these are our various roles. This is what we are committing to do. And you put that in writing. It is important to put it in writing, but it's also important to have the meeting. And then someone has to be responsible for checking up on the status of that plan pretty much on a weekly basis, if it's going to have any meaning at all, any role in keeping kids safe in their families. And if someone is not doing that within a week or two, it isn't going to be a functional plan. So that's one of the rules. Now, the second rule that I would offer is that, and again, I found out this through very hard experience. You really have to have an active parental partner for a safety plan to work. So I want to say that again. For a safety plan to have any chance of working at all, there has to be a partner who is actively cooperating with the safety plan. And what that means is that when there are scheduled visits, the parent is actually there. When there are appointments for kids to be checked by nurses or doctors, the parent actually takes the child to the appointment. That if something happens with a DV kind of incident in the home, the parent contacts the caseworker or her safety monitor ally and tells them that. There has to be a parent who is functioning like that for a safety plan to have any chance of working. Now, one of the things that I found in past years before I knew any better, that when I didn't have an active parental partner, what I was doing basically was chasing people around who didn't want to see me and trying to sort of catch them at a time when I could check on the status of the kids, but they didn't really want me to find them. So under those conditions, safety plans cannot possibly work, not ever. Now, so that's the sort of the second thing. So I've mentioned again, you have to have an active parental partner. You do have to have a safety monitor. That is a very, very important thing. And then there has to be some kind of understood kind of consequence or some kind of understanding for what's going to happen if the safety plan is violated. So here's the other thing I found in the child fatality reviews again and again. Even when caseworkers find out that parents were blowing it off or relatives weren't doing anything at all, they didn't go back and do anything different. They didn't remove kids. They didn't even go back and re-up the safety plan. They did nothing. So it wouldn't be a surprise that the safety plan wouldn't work in that situation. So some of it is content and substance of the plans. Some of it is the implementation of them. Some of it is, frankly, people weren't serious about it in the first place. And then, of course, you can't actually have a safety plan work with caseworkers who can only visit a family on a once-a-month basis. So if caseworkers are busy, if they're overwhelmed with workload, if they have too many cases, they tend to focus on the initial things they do in the case, on the initial assessment pieces, because that's how they're going to be evaluated in terms of agency performance. So you tend to get a lot of caseworker involvement in the first few days, week or two of a case. And then you get much, much less caseworker involvement after that. But if the caseworker has spent that first week or two developing a safety plan for the child and family, but then doesn't follow up consistently and regularly thereafter for a period of 2, 3, 4, 6 months, the safety plan is just a fiction. It's just a nada. And that is what is going on in this state and around the country. And that is what is so concerning to editorialize again about HB 1227, because, of course, that law implicitly expects that agencies are going to be able to protect kids in the home of their families. And maybe potentially they even could if they had the right resources and if they had some understanding and some ability to carry out the safety plans, but they don't. So therein lies the problem. Okay, so that's sort of the broad kind of picture of it. But the situation is even more extreme when you get down to the issue of safety plans for babies and toddlers. So remember the idea of a safety plan. I mean, one of the ideas is that, let's say that a child, maybe a young school-age child, has been abused. and there's a safety plan involved there. And maybe there's an understanding that there could be another abusive incident in the family. With the idea of the safety plan is that if abuse happens, we're going to know it. We're going to be able to do something about it. Of course, that's with a 6-year-old, a 7-year-old child. That same kind of thinking cannot apply to babies. You cannot have safety plans that assume that babies are probably going to be physically abused again. That is not a safety plan. That is crazy. That is crazy thinking. That's why it's so dangerous to use safety plans with babies and with toddlers, because you cannot have any fuck ups, to put it bluntly. Safety plans have some possibility of working if they're thoughtful, if they're conscientiously implemented and so forth, when kids are somewhat older, where there can actually be re-abuse without there being a child death or without a child being hospitalized or something. But when you're in a situation where just one incident can kill a kid, it just cannot be like that. You cannot have plans that sort of assume that during a relapse or during some other kind of mental health crisis or DV thing, that kids probably are going to be seriously re-abused or neglected again. And that's just part of the assumption of a plan. It can't be like that for the little ones, for the kids in the 0 to 2 or 3-year-old age range. So there needs to be, I have come, and this is actually a long period of thinking about this and a lot of personal experience with it. There just cannot be the same dependence on safety plans for kids in the 0 to 3-year-old age range that there is for kids in the 3 to 17-year-old age range. Those are two different categories of children, and the risks are so much greater for the little kids. So just remember, 45% of kids who die from child maltreatment are 0 to 1, 45%. 80% are in the 85% are in the 0 to 3 category, right? It only takes one time. And the physical abuse side of things there, right? So okay, so that's sort of the downside of it. So on the positive side, what can states be doing, or what they ought to be doing? Apart from what I've already said, they need to be forming partnerships with researchers. That really need to do that in this state and in other states as well. We need to be researching the safety plans. But putting that aside for a second, what other kind of services would be helpful? So the most effective safety plan for an infant with a substance abusing mother is going, if that child is not in foster care, is going to be that the child and mother going to a 24-hour residential care program. That's what we should be developing, that potential in this state. Now, I have been told recently that there is only one such program in the entire state of Washington. I hope that's not true. I hope I'm misinformed here. But Maddie's Place in Spokane is a facility like that. When I left child welfare in this state in the early 2000s, we had 8-10 of those facilities around the state. Not just we, the Substance Abuse Administration was very invested in that kind of approach. Pregnant and pairing women treatment programs. Somehow we have not built an infrastructure for that, despite all the rhetoric about reducing foster care safely and keeping kids safe in their own home, for example. The state has not done what it would take to do that safely. And that would start off with residential care programs. In the absence of that kind of program, the next thing you want to be able to do is you want caseworkers to be able to put very little kids, and I mean babies as well as toddlers, into pretty much full-time therapeutic childcare programs. There was a time in this state when we had those kind of programs. We had Child Haven type of programs that were federally funded all over the state, until both the feds and the state cut the funding guts, cut the foundation of the funding streams. But we actually had that in the early 2000s. I want to stress this again. This is like the need to go back and rediscover some of the things that we were doing that were good things, that actually did keep kids safe, and that we know how to do. We had the expertise to do it in this state, and we did it. But we haven't done it in recent years, despite foster care coming down. So foster care has come down, but the kind of things that would keep kids safe in foster care, particularly the very little kids, those things have not increased. Therein lies. So what do we want to be doing with safety plans? Particularly when you have issues around chemical dependency, or you have issues around domestic violence or mental health issues, along with, of course, always poverty. Once you have those issues, one of the goals of safety plans needs to be to reduce the child care burden on parents. These are parents that have functional impairments caused as a result of drug and alcohol, mental health, domestic violence, histories of trauma, poverty itself, and sometimes other factors as well. So one of the first things we should be doing in child welfare is figuring out how do we reduce the child care burden on those families to the maximum extent we can. And so 24-hour residential care programs is one way. Therapeutic child care programs, that's another way. Public health nurse visits, and particularly to families that have disabled or chronically ill children. Those are the kids who are at the highest risk of death. I want to say this again. I cannot underline this too strongly. The kids in child welfare who are at the highest risk of death or disabled or chronically ill kids who are in the care of parents with drug, alcohol, mental health, and DV kind of issues. So there needs to be a whole set of services focused on the needs of those very, very vulnerable, ill, disabled kids, as well as the child care thing. And that, and remember, there was a time in the state when we had home support specialists. We had robust public health departments. When I go back and think about what we have lost over 20, 25 years, in the midst of all this social justice rhetoric, it's just amazing to me that all this has happened, but somehow all that rhetoric, all that high-minded stuff has not resulted in a concerted effort to create the kind of services that would actually keep kids safe. So that's the dilemma that we are in, that we, collectively speaking, that the state is in, that caseworkers are in, and that all of you are in. Now, where you're going to kind of confront this most likely, most often, is there are two types of situations, particularly in the context of HB 1227. There are going to be many instances now, currently in the near future, where kids are removed for various reasons, sometimes very little kids, sometimes older kids, and then even before a shelter care filing, they're going to be returned home. And sometimes those kids are going to be returned home with a safety plan. Occasionally, there might even be a court filing. There would be many of those cases that probably would never come to your attention at all, because maybe now there wouldn't be a court filing as there was before, but probably some of them there would be. And there may even be an increased use of in-home plans, of in-home service plans and so forth in the context of 1227. I mean, I hope there is. So those plans may come to your attention in that context, and also, of course, in the context of reunification. So I would hope that, what now I think is called in the agency trial home visits, I would hope that trial home visits would be usually accompanied by safety plans of some sort. And let me just explain a little bit of the thinking on this in child welfare that sort of stands in the way. This state uses a safety framework from Action. That safety framework has the mistaken idea that kids are either safe or unsafe. Well, that's just not true, but that's the framework. So within the Action framework, the idea is that you would have a safety plan if kids were actively in danger. That would be the idea. You would only be using safety plans if you believe through the assessment process that kids were actually in danger. That is, not that they were at high risk, not that there all kind of bad things could happen, but that they were actually at risk of imminent harm right now. That's when you would kind of use a safety plan. But for many of the kids that are going home, of course, they're going home because presumably decision makers like yourselves and courts and caseworkers believe that they would be safe, at least for the foreseeable future. I mean, I would hope that would be the thinking. And yet, of course, those parents have ongoing issues with drug, alcohol, and with mental health and with DV. And a lot of times with other issues kind of as well, sometimes with disability. In those cases where there is the possibility of the actuality of a chronically relapsing condition there needs to be a safety plan, even when kids are not perceived to be in danger. And I would hope that that's occurring. I'm not sure that it is, but all of you would have a better idea than me. But anytime that there is a very strong chance of relapse, of a condition that could affect the safety of kids, there needs to be a safety plan. You know, whether you call it a relapse plan or whatever you call it, there needs to be a plan about, well, what's going to happen if the parent begins to use again? Or if the parent has a mental health episode, an episode of major depressive disorder or a psychotic episode, what's going to happen then to protect the lives of kids in that situation? And so I guess what I'm saying is that in reunification, even if when kids are not perceived to be in danger, otherwise, if they were in danger, we wouldn't be sending them home. There still needs to be a relapse plan that people sit down with the parents and talk about. And so that has many of the components that I mentioned already, and I'll mention a few others here in a minute here. So let me just stop here, and I'm not quite sure where we are with time, but maybe stop and for comments or questions here.
Yeah, this is Pam Jensen. I'm a CASA in King County. I'm really appreciating what you're saying. And I'm also thinking, it's making me think about what we know we could do better if we had different resources. And when I've talked with people about that, and I've said, if we had the resources, we could get, especially babies maybe, home sooner. It wouldn't have to take 5 years to get a decision on whether a newborn baby is going to be reunited or not. We would be able to do it sooner. But if we did it sooner and our caseload began to drop, then the resources would be dropped as well. And I don't know if that's absolutely true, but it does seem like it's kind of a catch-22 of the better we get, the less we get. Is that true?
Well, at various times in the past, it's been true. In the sense that, so to give a concrete example of that, there was a time in the early 2000s when, we reduced foster care from about 10,000 to about 8,000 at a point in time. Now, of course, it's around 6,000 or something. But, even at the time when you have 2,000 kids less in care, that's really a lot of money. And so a lot of money that the state saved. So at that time, I was a child welfare manager at that point. So we tried to convince the legislature, let us keep this money and reinvest it in prevention services. And of course, the answer was no. It was not. It was just like, and it wasn't just no, we have other priorities or something. It was just like a contemptuous no. I mean, the state has other needs here. So this state has had many opportunities to reinvest foster care savings, not many, some in the early 2000s. And now, of course, the state has, come down from an average of 9,000 to 10,000 kids in care to no more than about 6,000 kids in care. They have a goal to reduce. So that's a huge amount of savings. That money could be reinvested in the kind of services that I've been talking about here, and in many other kind of services as well. And it's just hard to get legislators who are being lobbied from all sides around the sort of the needs of the state. And, there are a lot of other people who are elderly, mentally ill adults, all kind of people have needs. So I realize it's a hard sell. But this state has had opportunities, and it hasn't taken advantage of the opportunities here. Now, what happens on the foundation side is even more frustrating to me. Sometimes foundations, and sometimes the federal government acts like this too, they will invest in a promising program, in a model project for 2, 3, 4 years, and then they want to see some outcomes. And then if those outcomes to them are encouraging, then of course, if it's a philanthropy, if it's a foundation, then they want the state to pick it up at that point. So this state has had many of these promising projects of the sort that I've mentioned, and a bunch more that have done really good things within a short period of time. But when the funding ran out, the state didn't pick it up. So I have never been convinced, and I'm not convinced now, that legislators are really convinced by evidence. They say they are, and maybe there's a few who are. For the most part, I hadn't seen it. So what they really like, of course, is very low cost solutions. They really like that. So the idea of reducing the residential care services that happen in the state over a period of 15 to 20 years saved the state an enormous amount of money, but just completely screwed the foster care system. So, so yeah, there has to be a little more wisdom now. Now, just to say this state phenomenally is in much better financial position than it was 15 to 20 years ago when we had much better we had better services when we had a fiscal crisis in this state than we do today, because those services have gone by for various reasons and no one has chosen to refund them, right? But it could be done. And the most current exciting thing that's happening in the state currently is that the state legislature, for the first time to their great credit, has invested in housing services. So this last session was described by some people as the session of housing resources. And so housing authorities in this state have now made a commitment to providing more than $30 million of housing services over the next few years. And the state has committed to $9 million for case management of people who live in those facilities. So this is like a first. This is like potentially a game changer for in the reunification world and for many of the families that you deal with in terms of being able to go home sooner, particularly when the housing services are good. There's also a discussion in some other places, some extent here, but more actively further along in some other places, about actually using income support kind of programs for the very lowest income folks there. So Washington, D.C. and New York City now are talking about, or actually not talking about, they're doing a pilot project of paying low-income families with child welfare cases $500 a month of income support over a period of 3 years, and then doing some kind of randomized trial to see whether that amount of income support makes a difference on referral rates and abuse and neglect rates and so forth. So I view that as being a fantastic development. I mean, that would be, so remember in this state, as of about 10 years ago, almost 60% of kids in foster care came from homes whose income was less than $10,000 a year. 60%. In other words, those weren't poor families, they were severely poor families, and that was 3/5 of the foster care population. In 2008, this is back when WISIP did their study on racial disproportionality, 80% of kids in foster care came from single parent families. Single parent families are poorer by large than two-parent families, right? So yeah, so there's a wealth of things that can be done here. And I realize we collectively, the state is not going to do all of them, but we really do need to be doing some of them. And not way down the line, but immediately. We need to be doing some of them immediately. So particularly around the childcare resources. Whatever you think about Ross Hunter and this vote of no confidence and all of that kind of stuff, the one thing the guy is really behind and he's really committed to is childcare. So this is something that can have a tremendous benefit for low-income families in this state. And that would mean to support, again, safety planning and safety plans, and to support also families in reunification efforts, right? So yeah, lots of things that can be done, but we actually need to start doing some of them, and quickly. Yeah.
So Dee, I can't even say cautiously optimistic, because I think I'm cautiously pessimistic about the housing bit, because what I'm seeing right now in a lot of cases, and I also work with the Friends of CASA organization, is that we're utilizing the priority now for relative caregivers to put a lot of kids into placements with relative caregivers who are themselves low income and are barely holding water on their housing and living expenses, and now moving they're with good intent and heart taking their relatives' kids in, and there is no support for them whatsoever. And then they're immediately, actually, I can't tell you the number of families then are immediately all of a sudden behind on rent, can't pay their utilities and whatnot. So while there seems to be this push for housing, and even in child welfare, it doesn't seem to be matching up with some of these pushes for relative caregivers. And that's a big area for some of the cases that I see as well. Again, even this push for relative guardianships and not in the traditional, the traditional sense, but just in the, more, I don't know. I always get 11 and 13 confused, but I think it's 11 is the non-dependency version of it. But anyway, so that being said, while there are certainly things the state should be doing, right now those resources are limited, those programs are limited. I used to see things like Child Haven, where we could put kids in for, a developmental or therapeutic preschool, 40 plus hours a week. What can we be doing, understanding that those resources and services do not exist today in the context of safety plans, or just in context of basic case planning, to make these kids more safe? So it sounds like pushing for, kids to have availability for daycare or childcare out of home, whether with parents and relatives, is one. What are other things that we can or should be pushing for today, with the very limited resources and focus that's on this?
Well, one of the things that I think ought to be considered is beginning to use foster care and foster parents for respite care. I think we ought to be doing that. And so in other words, sometimes to use foster care as a family support service as opposed to an alternative to family care. We have a lot of, so amazingly, when you have a shortage of foster parents in the state, you would think that all the foster parents are being used to the max and so forth. Well, that's just not true. I mean, you can go around and find licensed foster parents who will say that they've never had a kid, right? Because they're not taking the kind of kids that the state wants to place with them and so forth. But it's possible that some of those licensed parents might agree to take kids for a weekend. And so I think that needs to be explored here. There is a service in King County that perhaps you're familiar with, called a program called Project Safe Families. Are you familiar with that? So that's through Olive Gardens. I don't know how big the program is. It was based on a program in Chicago where parents could volunteer, sort of a respite care program, but parents could voluntarily agree to place their kids for a few days, a day or two or 3 or 4 days with a family, usually a church affiliated kind of family, without there being any child welfare involvement whatsoever. So that is another program that has been around in this state now for over 10 years, but it's never taken off to scale. I think there is a program like that in Pierce County to some extent or other, and in King County to some extent or other. So I think on the child care side, I think there needs to be some active outreach of child welfare people to the child care side of DCYF. So just because all those people belong to the same agency doesn't mean that they're all talking all the time and everything. It doesn't mean that they're actively collaborating, but they could. So now there needs to be some active sort of interagency, interdepartment here discussion about how to make the best use of the childcare resources that we actually have here. I think we can also urge some of the sort of the foundations in the state. I mean, even foundations as small as Giddens, but some of the other foundations, the wealthier ones, to actually make some investment in these kind of programs that would enhance the safety of kids, right? And whether that's projects like Maddie's. Now, the other thing that's very, very frustrating here, Family First was passed 3 or 4 years ago, that federal law, if you remember, with the idea of creating programs just like Maddie's Place, programs for parents with substance abuse and with mental illness and so forth, so that there would be an alternative to foster care for those families. As of 3 years, this is amazing. After 3 years after the creation of Family First, you know how much money had been spent in Family First after 3 years? $29 million across the country. Nothing. Family First has come to nothing, despite all the rhetoric, all the BS about it and so forth. But my point about it is, it's there. The law is there. It is also possible to fund some of these programs through Title 19, right? So I guess what I'm saying is there are underutilized federal funding resources that can be used for many of these programs. And so it's a very great source of frustration to me, because I know this to be true. That why wouldn't the state be using these resources to the very max, that the federal government has put that money out there? And of course, that's now also true in the area of homelessness services. The federal government has made billions of dollars of homelessness services available to states. States have to do their part. So I guess the other thing I'm going to say is around this housing thing, because I'm cautiously optimistic, but the reason that I have some reservations is because about 8 or 9 years ago, the state got a multi-million-dollar federal grant for housing vouchers. And at this time, I was going on about naively about how this was going to change child welfare in this state, and there was going to be greatly improved reunification and so forth. You know what happened? Not $1 of those federal dollars was ever spent. Not $1. Because DSHS at the time was the umbrella agency for child welfare. They wouldn't put up the money for case management. And because they wouldn't, the housing authorities would not provide the housing. So this time, the reason I'm sort of optimistic is because the state has put $9 million in for the case management services. Nevertheless, the state still has to implement that. DCYF still has to implement. So one of the things I've discovered in the last 2-3 years, I don't know how, I guess I'm a slow learner. I mean, even when governments provide money and lots of money, there's no guarantee at all that agencies are actually going to make good use of it. And of course, any of you who live in King County are learning that about homelessness services as we speak. I mean, all kind of unspent money in King County on homelessness services. Why in the world? But it's true. You still have to have the people who are competent to implement. So we've gotten to a point where a lot of times in government these days, people are mainly listening to rhetoric. They're listening to statements of values. And if people have good values, we think they must be competent. It doesn't follow. You can have good values and not be very competent. Or you can have supposedly good values and be a hypocrite. Also completely possible. So you have to look around for people in government who can actually deliver the goods here. And that's actually just editorialized. That's what you actually need in the child welfare system in this state. We need people who can deliver. Making the maximum use of resources that they've got here. So back on the sort of the safety planning kind of thing here, and I've mentioned back to the rule that you need to think about safety planning in terms of 2 categories of kids, right? The kids who are in the 0 to 3-year-old age range, that's one thing. The kids who are in the sort of the 4 to 17-year-old age range, that's something else. Because again, you can make much safer, more effective, better use of safety plans for the 4 to 17-year-old age range than you can for the 0 to 3-year-old age range. So part of the problem, and I just want to say it for those of you, I don't have the answer to this, but I just kind of want you to be aware of it. So there is no effective safety plan to prevent rollover suffocation deaths. So, when I went back and looked at these 40 deaths that I mentioned before in the child fatality reviews, about 1/3 of these kids died in rollover deaths. I mean, they were unsafe sleep situations, right? Most of the time with substance abusing parents. The safety protocol within DCYF right now for those kind of kids is that caseworkers are supposed to not only inform parents of these safe sleep guidelines, and hopefully they're handing them those guidelines in writing or something. At the same time, they are supposed to observe the kids' safe sleep arrangements. The problem is that just giving information isn't enough. We already know that from all these fatalities. So a lot of times parents are sleeping with kids, it's not because they haven't been informed of the dangers, it's because their emotional needs are being met by that close intimate contact during sleep, right? So we don't have a safety protocol for that. And so in the absence of that, of course, there have to be frequent reminders of the importance of safe sleep, of the guidelines. And by the way, these guidelines are out. JAMA has these guidelines. The American Association of Pediatrics has them, and they're pretty straightforward. They're pretty simple. They're not hard to understand at all, right? But you still have to get people to follow them. I found about a couple of deaths in each year from little kids had gotten into fentanyl. So a parent left their fentanyl around in the living room or the kitchen or someplace, and a little toddler gets into the fentanyl and takes it and dies, right? There's no safety protocol whatsoever in DCYFs currently for fentanyl injection. What could it be? What would that be exactly? Would you want a parent to promise, I will not leave my fentanyl on the kitchen table? I mean, there's been some discussion here recently of actually giving parent lock boxes to put their drugs in. You just want to throw up your hand. I mean, what's the safety protocol for drunk driving? Don't drive while drinking. A couple of kids die every year, 2-3 kids from drunk driving, and not only just the little kids. I mean, the older ones as well, right? So there are just some inherent dangers there that it's very difficult to control with safety plans. But nevertheless, there are some that have to do with the day in, day out care of kids and with the sort of the adequacy of the physical environment, so that there aren't obviously physical hazards around. The things that can be fixed, we ought to fix. You know, I actually read a fatality review here where there was one 2-year-old who died after, in her mother's arms after she fell out of a second-story window. Without a screen on the window. But, you can actually do physical changes to homes to make them safer. And I think some of that kind of stuff we can actually do, right? But for the most part, for most of the families with the very little kids, the first rule needs to be that we're going to reduce the childcare burden to the maximum extent we can. Whatever that resource is, we're going to use it to the absolute total max. And secondly, we're going to make sure that people's basic needs are met. So I don't know how anyone in the world thinks that you're going to use behavioral health programs with people who are food insecure, or people who are sleeping in campers, or who have horrible dental pain, but they don't have dental insurance. What is everyone thinking? So this is why we've come to this point in child welfare where lots of people just want to reject it whole cloth out of hand here, because in some respects, the approach to families has been inhumane. Worrying about their drug abuse problems, but we're not worried that they're starving to death. We're not worried that they're doubled up with 2 other families in a 2-bedroom place with 10 kids. So there has to be a lot more attention to the poverty-related needs of families, right? That's just a basic humanity, but it also deals directly with child safety issues. And then sort of the second thing is to reduce the child care burden to the maximum extent that we possibly can. And the third thing is, of course, there has to be the willingness to see when safety plans are not working. Because I've already said this, most of the safety plans are failing. There are indicators of that. We don't have to wait for a kid to be harmed to know that a safety plan isn't working. A parent isn't carrying out the plan. It's not working. Therefore, there has to be a change, and an immediate change. If the safety plan is based on the idea of kids being in danger, and the only thing that keeping kids safe is the safety plan, and people involved, relatives and family members, aren't carrying out the safety plan, the kid has got to be removed immediately. And somehow that message hasn't gotten through to the child welfare world of HB 1227. And so I don't know what it's going to take here. Maybe it's just going to take a lot of really horrible things to happen here, right? But in the meantime, we can still do the things that from practice wisdom, we know we got to do here. So,
Hey, Dee, that brings up an interesting point. Other than removal, are there any elements of a safety plan, like if it is violated, can you think of any ways that we can hold parents accountable to the safety plan other than removing the child? Are there any elements?
Yeah, so remember that so there's a good rule of thumb in decision making. If at all possible, this isn't my rule, I'm just bringing it up from someone else. You don't want to be stuck with either or decisions. You don't want to be stuck with a decision that we either do X or we do Y, when X and Y are both kind of extreme positions, right? So you always want to try to create other kind of options. So in past years, and I'm just going back to things we did in the past, but I think many of those things can be done now. So sometimes you can get someone to move in with the family. Sometimes you can get the family to move in with someone else in terms of relative. That is a very common safety plan in many states, to get family members to move in with other family members who you believe are conscientious and so forth. There still is an issue about how you can implement that kind of safely, but it's not the same thing as involuntary removal of kids from parents, right? There used to be, you kind of remember from years past when Family Preservation Services had a whole, I mean, wow, they had a huge PR campaign in years past about the kind of things they did to preserve families. So they used to say that their workers, FPS workers, took sleeping bags into families and slept. Well, I never knew any FPS worker to actually ever do that. I think it was a total, I don't know, there was a lie. Maybe it happened once somewhere and they used it as an ad or something. But the point is, it could happen. It's not like unthinkable. I mean, we could actually be using home support specialists. There ought to be pressure on the agency right now to begin adding home support specialists here who can actually, if chronically neglected kids are going to stay in the families, and they are staying in the families, and they were staying there even before HB 1227, then we need people to go in and help with those kids to some extent on a daily basis. Those people are paid about half what the caseworkers are paid. I mean, it really isn't a more of an affordable kind of a deal here, right? And then, of course, you have the situation with all of you, the CASAs and the caseworkers. So you have caseworkers a lot of times who there's no way in the world with those caseloads that they're going to be visiting those families on a once a week or twice a week basis. But that's what they need to be doing to carry out a safety plan. To some extent, those of you in the CASA role can, do some of that home visiting. At least I would hope that you could. When caseworkers are not able to do it. And I don't mean just you, but other people as well. So those are some of the kind of things to do there now.
I have a question. This is Karen from Klickitat County. What about this dilemma we have where the children are removed and they might do well with a home builder or a family preservation service, but they're not eligible for that because the kids aren't in the home? So this, how do you make it happen where the parent is given a chance to work with an in-home support, yet, child welfare is not certain that they're capable of parenting? It's this catch-22.
Well, can I just tell you about agency services that, for every agency rule about when a service can be provided, there is an exception to that rule. So whenever anyone in a child welfare agency tells you that we can't do X, Y, or Z because of some rule or other, that's always kind of a half truth. That's a disingenuous statement. It might be true on the surface. It might not be a lie. At the same time, it's not strictly true either, in the sense that they can waive those rules when there's a need to. So for example, there used to be a rule in the TANF program in this state that if kids were removed from families that they could not be, that families could not receive TANF, they would lose their welfare benefits immediately, and they could not then get the benefits back till the kids were back in the home. So that was kind of a catch-22 thing. Some of us, many of us, not just me, but many of us actually got that rule changed. That was administrative rule. We got that rule changed so that, Ruth Kagi was very instrumental there, and so were other people. But we got it where you could put people back on welfare before kids came back into the family. And I think the same thing is true of many of those services that would be helpful and supportive there, right? There's also the possibility, again, and there has been for a long time, of using the foster parents in a more supportive role to birth parents. And this has been done in Clark County in the state to some extent or other, and in some other places in the state. But there really is the potential to do this to a much greater degree. I don't want to say to scale, but to a much, much greater degree. To use foster parents both as educators, as coaches, for emotional support, for respite care once kids have gone home. All that stuff is possible. And it's not money that's stopping it. That's what's so frustrating here. It's imagination. We just have to be willing to use foster care in a somewhat different kind of way. The foster parents are there. Many of them are really willing to be helpful. They're just not going to take a behaviorally troubled 12-year-old kid who's going to burn their house down. At least they fear it, right? But they might take some of the littler kids for, shorter periods of time, right? So, and then I want to tell you the one other thing. I worked in child welfare in the 1980s in Spokane at a time when we did not have one penny of actually agency money for poverty-related services. And we were dealing, of course, just as now, with a low-income group of families all the time. The people that I worked with, we spent a lot of our days going around Spokane raising money. We call service clubs, we call foundations. And by and large, I rarely had someone tell me no. So and we did all kind of things. So we put braces, we paid thousands of dollars for braces I mean, we did a lot of good things for people through the philanthropies in the state, the minor ones, not the really big ones, through service clubs and so forth. I think to a certain extent, people in the community can do things like that for these families. That would be very, very helpful to them. And there has always been the idea in this state that maybe there could be a consortium of churches, then maybe the churches would adopt a family to be supportive of them in some kind of way. That's always been a possibility, and it still is. You know, I recognize that you're in a situation, however, where, as the caseworkers are, that many of these things are possible, but that's not the situation you're dealing with today. And of course, you got to deal with the situation you're dealing with today. And at the same time, there has to be a conversation with people, and not just the caseworkers, but at least at the middle manager level, about what are some of the other resources that would just make this easier. I mean, certainly people in the child welfare system, they don't have any investment in kids dying. You know, most of those people really do want to protect kids. So I think we have to have some of these discussions here. And in the meantime, however, you got to draw the line about some of the thinking on the safety plan stuff. And sometimes, even at the cost of conflict, you just have got to say it to the people involved here. And this means to the judges too, because the judges on this subject, many of them are very, very naive. They think they know something that they don't know. So sometimes this has to be pointed out, that we don't have good safety planning technologies or methods or resources for the very youngest population of kids. And even if we had those resources, we don't have an agency that's staffed to the point where they could carry out and implement those resources in an effective way. So that just has to be said at times, really, even at the cost of making a decision maker somewhat unhappy. So. I think I'm going to stop there. I don't know where we are in time, but I think I'll stop there. On this subject, by the way, Ryan, I did a few years ago, I did write a sounding board commentary on this subject of safety planning, and some of the things that I said today, I said in the commentary as well. And anyway, in the next couple of days, I will send you the commentary, and if you want to make it available to people, you can here.
Thanks, Dee.